Introducing Mitosol, a convenient and safer way to use Mitomycin-C for ophthalmic surgery. This video will demonstrate how to safely and efficiently use the Mitosol kit. First, let's take a look at what is included in the kit. The Mitosol kit is made up of two main components, the white outer pack and the sterile inner tray. The contents of the white outer pack are sterile and include the package insert, instructions for use, which should be read prior to use, a Ziploc chemotherapy waste bag, two patient chart labels, and the sterile inner tray. The sterile inner tray contains the components needed to reconstitute and use Mitosol. Its contents include the Mitosol vial and a vial adapter with spike, both within a blue foam pouch, a syringe containing 1 ml of sterile water for injection with a safety connector pre-attached, a white plunger rod, a sponge container with pre-cut sponges, a 1 ml Lurlock TB syringe, and an MMC label to label the drug while it is on the sterile field. The Mitosol kit contains everything needed to safely deliver the desired concentration of Mitomycin-C. Let's get started with opening and dispensing the contents of your Mitosol kit for use in ophthalmic surgery. The contents within the white outer pack are sterile. This pack should be handled, opened, and its contents dispensed by a circulating nurse. The sterile inner tray and its contents are also sterile and must be handled, opened, and its contents assembled and dispensed by a sterile scrub person. Before the reconstitution of Mitosol, it is recommended that you first prepare the sponge tray. To do so, remove the sponge container with pre-cut sponges and TB syringe from the inner tray. Dump the pre-cut sponges back into the inner tray. Select the surgeon preferred sponges and place them back into the sponge tray. Close the lid. Attach the Lurlock TB syringe to one side of the sponge tray and set aside while you reconstitute the Mitosol. Next, we'll show you how to safely reconstitute Mitosol. Please note that double gloving is specified by USP 800. A sterile scrub technician shall perform the following steps. Remove the Mitosol vial and vial adapter from the blue foam pouch. Do not attach the vial adapter with spike to the vial at this point. Next, screw the white plunger rod into the plunger of the pre-filled syringe. Push and twist the vial adapter with spike onto the safety connector until it is firmly seated. Place the vial on a firm, flat surface. Push the syringe down and spike the vial. Then inject the sterile water into the vial. Invert and shake the vial to ensure complete drug reconstitution. Once the Mitosol is reconstituted, it's time to soak the sponges. Now we'll demonstrate how to prepare the sponges. A sterile scrub technician shall perform the following steps. First, invert the vial and draw the full volume of medication into the syringe. Next, unscrew the vial adapter from the safety connector. Make sure that the vial adapter remains fully seated to the stopper of the vial. Screw the syringe that contains the Mitosol into the sponge tray on the opposite end of the already attached TB syringe. Next, inject the full volume of the medication into the sponge container to saturate the sponges. Please allow 60 seconds for the Mitosol to be fully absorbed by the sponges. After waiting 60 seconds, any excess fluid within the container can be removed by withdrawing the plunger of the TB syringe. The Mitosol is now ready for use by the surgeon. It must be used within 1 hour of reconstitution. Next, we'll show you how to properly use the Mitosol during ophthalmic surgery. The surgeon will now apply the saturated sponges to the surgical site. After the allotted time has passed, the surgeon will remove the sponges and place them back into the sponge container. Additionally, the forceps used to handle Mitosol sponges should only be used for this purpose. These forceps should be isolated from the other instruments and hand washed before returning to the tray for processing. Let's review the final steps. The entire assembly, the vial with vial adapter attached, and gloves used at the surgical field will be placed into the chemotherapy waste disposal bag. Do not disconnect the syringes from the sponge tray. Do not forget to place your surgical gloves into the chemotherapy waste bag. The chemotherapy waste bag must be disposed of in an appropriate chemotherapy waste bin. Thank you for watching our in-service video on how to safely and efficiently use the Mitosol Kit. As the only FDA-approved formulation of ophthalmic Mitomycin-C, Mitosol ensures compliance with all laws and regulations related to the acquisition and use of Mitomycin-C. Thank you for using Mitosol.